Hi, everyone. Welcome to Get Well with Dr. Shel. I am Dr. Drshelenalaljiesthetics, better known as Dr. Shel, and I know as a board-certified OBGYN and a functional medicine expert, your health is unique and deeply personal. It is a combination of genetics, lifestyle, and environment. Know this, no matter what your starting point is, you are never powerless over your health. Being on a health journey is a marathon, not a sprint. This podcast is about walking you through many different perspectives on health conditions, symptoms, and solutions that can help you get from fatigued to fabulous. My mission has always been to offer my patients and community the best of mental, physical, and spiritual wellness. You can learn more about me and my wellness center and schedule your telehealth appointment at drshel.com. We can support you no matter where you are in the world. This podcast is a powerful and simple way to carry the wisdom of thought leaders from around the world in your pocket and continue to develop your own healing journey every single day. So let the journey begin. We have a very interesting topic today, and that is dental dangers, the roots of disease, how dentistry impacts systemic health and neurodegenerative diseases. As you all know, neurodegenerative diseases and ALS is very near and dear to my heart, and that special interest and special passion began for myself and my family over 3 years ago, now going on almost 4 years this year when my sweet darling husband Ayez was diagnosed with ALS. When he was diagnosed with ALS, we, of course, dove right in to try to create an excellent team of physicians, dentists, and practitioners who could give him the best care possible. And one of those incredible team members were Dr. Stuart Nunnally, who is a graduate of the University of Texas Health Sciences Center Dental School in San Antonio. He maintains an integrative biological dental practice in Marble Falls, Texas, where he has treated patients from all 50 states and 24 countries, including my husband and myself and several of our patients. Dr. Nunnally is a board-certified practitioner in naturopathic medicine and is board certified in integrative biological dental medicine. He serves on the teaching faculty of the Academy of Comprehensive Integrative Medicine and the American College of Integrative Medicine and Dentistry. He frequently teaches on all aspects of biologic dentistry. So welcome, Dr. Nunnally. So good to have you with us today.
Thank you, Shel. It's a joy to be with you.
Absolutely. You and I go back many, many years, as you have been a part of our journey, an intricate part of not only our journey with Ayez, but you were a big part of our ALS mastermind that we had put together in 2019, where we got about 30 some practitioners together to come up with protocols and the latest research and treatments for devastating diseases such as ALS, Parkinson's, MS, Alzheimer's, and more. Mm-hmm. So thank you for all of your help that you've given the entire neurodegenerative community, patients, as well as our family. You've just been a really big part of our family and our journey. So we really, really appreciate that, and really happy that you're here to share all of your wisdom on dentistry with our listeners today. So I'd like to start with what is the unique nature of biological dentistry? Not everybody's heard of biological dentistry. Of course, everybody goes to their dentist, they get their cleanings, they get their wisdom teeth extracted, they get so many other things in dentistry. And as my listeners know, my husband is also a dentist who has practiced for over 25 years. But how is biological dentistry different from traditional dentistry?
For the most part, I think, Shel, it would be close attention to what materials we use. Mm-hmm. For years, dentistry has not paid much attention, in my opinion, to the materials that have been used, especially for restorative dentistry. When you think about still, even to this day, mercury being used as a filling material.
Right.
And of course, that's been argued about for years. I think we should be long past that stage and just acknowledge the fact that mercury has no place in the body. But at any rate, it was used for many, many years. And then, of course, there are so many other materials that have been used in dentistry, one being nickel. Nickel is a material that's used oftentimes, for example, under crowns and for
Right.
various removable bridges and so forth. And that's a material that has a terrible track record especially from a health standpoint.
Yes.
And then, of course, we have to throw fluoride in there because fluoride is just competes. Of course, it competes with iodine for our thyroid. But I mean, we have iodine in every cell in our body. So
Right.
fluoride being the most active element on the periodic table, it will compete and outcompete iodine in almost every case. And so we have in dentistry, I think, used materials over the years that we never should have used. And and also, of course, there's so much attention these days being paid to BPAs and how the exposure that we have to BPAs. And in dentistry, many of the filling materials, the white bonded filling materials, also contain those. So as a biological dentist, I'm very concerned about that. I'm probably more concerned about someone's systemic health than I am than their dentition. Although I want to marry those two in a beautiful way, and there is a way to do that, not only in a holistic way, but a cosmetic and a functional way.
So, with that being said, who would be a typical patient who might have certain conditions that actually should drive someone to seek biological dentistry? What are some chronic conditions that you see that are directly impacted with what might be going on inside your mouth, whether it's a history of mercury fillings, whether it's a history of wisdom teeth extraction or root canals? What are some of the chronic diseases that you see that may be very closely related to some of the dental work that has occurred in the past?
Yeah, I think for the most part, um, most of the most well-known autoimmune issues, quite frankly, I think we can associate in some way with dentistry. We've seen this over and over again: rheumatoid, lupus, Sjogren's, scleroderma. Those sorts of autoimmune issues we've seen oftentimes associated with dentistry, and we've seen oftentimes those improve quickly when the toxicities associated with dentistry are removed. Some of the others that we know probably play a role or have played a role in other diseases like ALS, because many researchers feel like the toxicities of this world, especially mercury, maybe play a role in ALS. Of course, in Parkinson's, we know that many of the Parkinson's patients have been exposed, have had toxic exposures. And so dentistry, I think, has played a role in many of these sorts of neurodegenerative diseases. But the ones I think that are impacted maybe the most are rheumatoid, lupus, and MS as well. We've seen that time and time again, where just relieving the systemic challenge of the dental toxicities can improve those diseases quickly.
Sure. So, in that sense, if you can explain to our viewers and listeners, how does the mouth, the overall health, overall oral health, how does the mouth and oral health impact the body? Now, we've, of course, seen multitudes of study with, connecting gum disease or periodontal disease to heart disease, for example. What does it actually do, and what is the process of oral health impacting the brain, neurological health, autoimmune system, as well as cardiovascular disease?
Well, one way it can happen is that the mouth is full of bacteria, Sometimes that particular microbiome can be skewed in one direction or another. And when it becomes skewed in an anaerobic fashion, those bacteria, they don't just stay in the mouth. They have the opportunity to become systemic, and they can certainly impact various organs. But maybe more important than that, we know that from the periodontal research associated particularly with heart disease. We know that those bacteria, for example, you can take the atherosclerotic plaque from a bypass surgery, look at it under a microscope, and it'll be infiltrated with the same bacteria that we see in periodontal infections. It'll be infiltrated with the same bacteria that we see in root canal treated teeth. And it'll also, it's the same bacteria too that we see in various osteonecrotic lesions that we call cavitations. Those are the bacteria that literally infiltrate these atherosclerotic plaques. And they also, this same research has been done in terms of cerebral plaques, where we see, again, the surgeons have taken little samples of these plaque deposits in the cerebral vessels, submitted them for biopsy or DNA analysis, and you can see that they're the same bacteria that are associated with dental diseases. So the bacteria themselves can play a big role, but oftentimes it's not so much the bacteria as it is the toxins that they produce. And we now know much more about these toxins than we used to, especially I think the toxins associated with these anaerobes that are in root canal treated teeth. The literature is just becoming overrun now in my field with the impact that these particular toxins are playing. Neurodegenerative impact, like things like causing even, I recently read an article that was titled "The Depression That's Caused by the Toxicities Associated, for example, with root canals."
Wow.
So we used to never see that sort of acknowledgement in the literature or that sort of research, but we do now more and more.
Right. No, that's very, very interesting. So the toxins that are being released are impacting, just to kind of summarize it for our listeners, the toxins that are being released with the bacteria that exist in the mouth are what may be triggering or exacerbating some of the conditions that people have, whether it's neurodegenerative or autoimmune or cardiovascular. And so in biologic dentistry, we're really addressing the root causes of this.
I think you're exactly right. And I think even if it's not the direct cause, and I think, as you know, in most of these diseases, there's a multifactorial cause or causes for the disease. But if we can lift the load off the body and improve the overall terrain, then we know that the body has an opportunity to heal. And so that's primarily what we're trying to do, is eliminate those toxicities and the anaerobes associated with them.
Absolutely. And, it kind of goes hand in hand in a lot of things we speak about in functional medicine. In functional medicine, we want to get to the root cause of many chronic diseases, and that's how we treat patients. We don't use the Band-Aid approach. We look and see what might be some of the insults that are triggering certain genetic predispositions, and what are some things that might be sort of things that we can do to regulate the epigenetics of different processes. So we always look into nutrition, supplementation, removing toxins, balancing the gut microbiome, checking for heavy metal toxicity, checking for mycotoxins, checking for candida overgrowth, food sensitivities, as well as really trying to achieve hormonal balance. And in that, we always add oral health, because as we are discussing, a lot of people unfortunately don't realize the vast impact of oral health on all of these chronic conditions, to the point that one of the first things that we did with Ayez, and he was diagnosed in November of 2017, and in December, we sought out a biologic dentist, because even though Ayez, had been in dentistry for 25 years, when he was 18, I mean, years ago, that's when mercury fillings were very, very common. And he had it placed and he just forgot about it and didn't even think about it until we were diagnosed, and we were trying to peel the onion and look at every single thing that could be contributing. And as you say, everything that we look at is oftentimes multifactorial, but we have to peel the onion and take away the different toxic exposures. And so we actually went to a biologic dentist and had the mercury fillings removed, and then we had the cavitation work done with you. So let's kind of be a little specific about mercury for our listeners. Why are mercury fillings so bad, for instance? What makes them so bad for our bodies? Can you explain that?
Sure. Mercury is, it's considered the second most toxic element on the planet, second only to plutonium. And a mercury containing filling, which is typically called, incorrectly, it's typically called a silver amalgam filling. However, 50% of that filling is mercury.
Yes.
And so the other four elements in an amalgam filling are silver, tin, copper, and zinc.
Mm-hmm.
And when you put that mixture together, it's a very long lasting mixture. So I have patients who have had mercury fillings for 60 or 70 years, 90-year-old patients.
Mm-hmm.
And, sometimes you run across someone who seems almost bulletproof to anything. And they may have a mouthful of mercury fillings and still appear robustly healthy. So not everyone responds to these sorts of environmental toxins the way others do, as we know. And so the problem is some people have an immune system where they do not get rid of the toxicities associated with maybe heavy metals.
Right.
And we know that now from genetic research. There are many SNPs in our DNA where some people detoxify well and some do not.
Mm-hmm.
And so we all have that. You and I both see a population of people who typically don't detoxify well. They struggle with environmental toxins. And mercury being as toxic as it is, I mean, everything else pales in comparison to mercury except for plutonium. You look at lead will be way down lead, arsenic, cadmium. They're all way down the list compared to mercury.
Mm-hmm.
So when you put that particular element in someone's tooth, we don't think about this, and we're certainly not trained in this as dentists. In fact, we're trained to believe that amalgam mixture is a very stable mixture, whereas we know it's a terribly unstable mixture.
Mm-hmm.
And whenever you mix metals together, they tend to disassociate. Well, and there's even videos of this on the internet, for Pete's sake, of extracted teeth with mercury fillings and a little plume of smoke coming off of it, which is the mercury vapor.
Right.
And you can, and of course, if you heat that up with a cup of coffee or you chew on it, or some people chew gum almost, 12 hours a day, all of that exacerbates the flow of the mercury vapor off of there.
All right.
80% of which is absorbed into the tissues. And so that's what happens with our mercury toxicity. Now, my 90-year-old patient who's had mercury in his mouth for the last 60 or 70 years and is functioning well, he's one of those who can just, he can handle it.
Right.
And we know many people can, or they think they're handling it and they have some sort of neurodegenerative issue, but no one ever associates it with a certain heavy metal toxicity because they're never tested for it.
Absolutely. Absolutely. Yeah. And I think it's important so I'd invite everyone who's listening to just go to a mirror, open your mouth, and see if you have any mercury fillings, because a lot of people have them and never really think about it or recognize that it is something that could do them harm. And, to really kind of put that into perspective, we may all have different genetic predispositions to whatever it may be in our gene pool. For example, it could be cancers, it could be autoimmune diseases, it could be neurodegenerative diseases, or what have you. And it is the epigenetics, it is the environmental exposures, your lifestyle, your stress, your diet, and other toxins that we're always exposed to that may trigger that gene. So if we want to be proactive and to be sure that we don't trigger something unbeknownst to us, we want to try to make sure that we limit and disassociate ourselves with as many toxins as possible, and mercury fillings being one of them, and a very important one. So if we speak specifically about patients with neurodegenerative diseases, Dr. Nunley, whether it's ALS, Parkinson's, Alzheimer's, MS, what is it that the mercury is doing for or in these patients that might trigger brain conditions, right? And I'll just kind of say along those lines before you answer the question, it is important to find out if you do have mercury that is in your body. So we, in functional medicine, we do heavy metal toxicity testing, which we do with a urine analysis where we do a pre-test collection of a 24-hour urine. Then we would give you chelation agents like DMSA and calcium EDTA to extract those metals and be able to see if you have an overload of these metals in your system. But say these patients do have an overload, Dr. Nunley, what is it about the mercury that is causing damage to the brain and the neurological health, if you will?
Sure. Well, unfortunately, the brain barrier is not a barrier to mercury, and so it easily crosses the blood-brain barrier, as it does the placental barrier. There's no barrier to mercury, and so that's problematic in itself. And mercury has a particular charge on it where it inserts itself in various key, especially in various key enzymes in the body. Once it inserts itself into a key enzyme or into a tissue, it's difficult to remove. We have some God-given detoxifiers in us, like glutathione, and that can help grab onto it and remove it, but it's not that easy, quite frankly.
Right.
And so we know, for example, with neurological tissue, it can play a role in the demyelination process of nerves. So you begin to lose the insulation to neurons or nerves, and so now these nerves don't fire correctly, especially when this happens centrally, like in the brain and in the spinal cord. It's an issue peripherally also. Okay, we know that various metals, heavy metals, can cause some peripheral, like neuritis issues, but oftentimes it's more of a central issue where it's caused actual brain damage or spinal cord damage. So that's, I think, of course, when we think about things like ALS and MS, we have to think, well, this damage is occurring centrally.
Right.
It's crossed the blood-brain barrier, and now it's interfering with actual neuronal function.
And just to kind of, reiterate some of the things that we spoke about earlier, of course, we know that, mercury is not the only thing that might be leading to ALS, MS, Parkinson's, etc., but it is certainly one of the known contributors in a lot of patients. Now, when you talk about ALS specifically, it is so multifactorial. And in all honesty, a lot of these neurodegenerative conditions, including Alzheimer's, nobody truly knows what causes these conditions, which is so heartbreaking for the families who are going through these conditions, because the entire family is affected in addition to the person who is affected. So not only do we not know what causes it, we don't know at this point, we don't have a good cure for these conditions. All we can do is we can look at the contributing factors, and we can try to remove them and treat them one by one to be able to strengthen the microterrain of our bodies, so our body itself can start fighting these and start healing on its own. And this is the entire basis of biological dentistry and functional medicine. And when we put it together, we're trying to strengthen your own body's ability to heal, which our bodies are just miraculous creations that can heal themselves if we give it the right environment. Would you like to comment?
Well, I would too. You're so right. And there's not a disease process that I know of that doesn't have a inflammatory component to it.
Absolutely.
And heavy metals, mercury in particular, is just known for the oxidative stress that
Mhm.
it puts on the body. It interferes with mitochondrial function in a huge way so that we cannot produce the energy that we would normally. We just simply don't throw off the ATP that we need in order to have strength and
Yeah.
stamina. So
Mhm.
we heavy metals are something that we need to pay strong attention to. And as you know, it's not. It's certainly not training part of the dental training. It's not traditional medical training either. How often would you have in your training ever been advised to even look for heavy metals?
Never,
Uh,
never,
no.
not until I entered functional medicine and started practicing functional medicine. And
Mhm.
now we look for heavy metals in, most of our patients, especially if they're even coming in with chronic fatigue or fibromyalgia or anxiety or depression or autoimmune conditions. And of course, neurodegenerative conditions, we're always looking to see what their heavy metal exposure and concentrations are. Um, when you remove somebody's mercury fillings, I know that you, along with that, you promote doing certain IV therapy to be able to strengthen their system. Can you talk about your process a little bit?
Sure. There's a process that's quite well known now in the US because the organization known as the International Academy of Oral Medicine and Toxicology
Mhm.
developed a protocol that's called the SMART protocol.
Yeah.
And you can go to the IAOMT website and you'll see the dentists who have gone through that training. And SMART is an acronym for Safe Mercury Amalgam Removal Technique. And I think your listeners should know about that because it's a good way to search out a dentist who's going to remove their mercury fillings in what I think is a very safe way. So the protocol that we like that protocol plus some. Um, uh, the plus some for us would be, well, let's I'll mention the basics of that protocol. One would be that every patient, if you're removing the mercury filling, would of course have a rubber dam that fits over the tooth so that none of the particulate goes down their throat, and it protects them also in a larger way from the vapor because the rubber dam, if it's handled properly, along with a large suction device, all of that together will really help against exposure.
Mhm.
Of course, using a lot of water when you're removing these mercury fillings literally helps drench it and keep it out of the environment. And then, in addition to those things, and many, many others, for example, when we treat our patients, not a millimeter of their skin is exposed at all, hair, anything, they're completely draped.
Right.
We look like spacemen when we work doing this, of course, and my staff too. And we have all sorts of things going on in the office to clean the air and make sure that we're not working in a mercury vapor fog.
Right.
But then in addition, I like the use not only of having a patient swish with either chlorella or charcoal before the procedure, but I like to use fairly high doses of intravenous vitamin C. Not because vitamin C is a chelator really at all, but it does help amp up our glutathione levels, and it helps keep our glutathione reduced in the state where where it's most available for attaching onto mercury.
Right.
So we like to have the patients do that during treatment and then even again the next day.
Right.
And I think it's valuable. It's tremendously valuable to me for that, but also, of course, for any surgical procedures. I think we get an enhanced healing response as a result of it. And um, I can't urge your listeners enough. Sometimes when they hear a presentation, maybe they want to rush out and go have their mercury fillings removed. And I think there's harm in doing that if it's not done properly. So I would encourage them to look for someone who's been trained in doing it very safely.
I couldn't agree with you more. I think it's very important to have the process be done correctly, as well as have your body supported correctly during and after the procedure. So I think that's really important. In addition to that, if you've been exposed to mercury for many years, as a lot of our patients have, I would urge our patients to have a heavy metal testing done so that they can see, in addition, whether they have mercury overload in their body. And in addition to that, what other metals do they have in their body, whether it's cadmium, arsenic, lead. And when we do the heavy metal testing, we are testing for all of these. And depending on what the results are, it's important to perhaps consider chelation so we can remove these from your body. And like you said, Dr. Nunnally, it's not an easy process. You can't just take a supplement and out it goes. It is a process that requires a commitment, but our body will function so much better when it's not overloaded with these toxic metals. So I think that's
I think too, Shel, and I know you've seen this too, when someone begins to turn the corner and all of a sudden, maybe they really haven't even had the energy to take a walk around the block.
right.
And all of a sudden, they not only take a walk around the block, but they're exposed to the sunshine. They get a little extra vitamin D, and hormonally things begin to adjust, and they get a whole cascade of new hormones they get a little UV. All of those sorts of things tend to build upon themselves, and you and I both know that patients can spiral back the other way to health as opposed to spiraling downward. And so I love to see patients make real positive steps. And
Right.
one positive step is addressing the dental part of it. One real positive step is seeing an integrative physician and doing these sorts of tests that you're talking about that aren't routinely run. Those are
Right.
just positive steps that make you feel better.
Right.
Um, and then before you know it, you're eating a little more properly.
Right.
One thing develops after another, and before you know it, you're living robustly again.
Elaine, great. It's all about, and I think it's important for our listeners to really know, understand, and believe that we can rebuild health in our bodies. Health is something that is not, it doesn't happen automatically. And especially once you spiral down, it takes time, effort, energy, and commitment to rebuild it, but it can be done. And
Can.
yes, functional medicine, yes, biological dentistry, but also, yes, 7 to 8 hours of sleep every night.
Mm,
Yes, meditation. Yes, mindfulness, yoga, healthy eating, movement and exercise, sunshine, and really staying connected with yourself and your social environment, with your
mm,
family, your friends, your outlook on life and positivity. All of those things are super important. And of course, being on the right types of supplements and herbs that are so important in our environment today because our food is just not what it used to be 50 years ago. So
true.
whereas we used to get this, the lycopene that we wanted from the tomato 50 years ago, we simply cannot. Even if you get organic tomatoes or organic what have you, we need those antioxidants from our greens, etc., that perhaps we just need to supplement with the right doses and the right products. So I think all of that is important, whether you're, trying to get well or stay well. I want to, before we, wrap this up, I really want to talk a little bit about cavitations. That is a word that is not really familiar to a lot of people. So I really want you to kind of talk about cavitation work, cavitation surgery. You've done actually my cavitations when I was diagnosed with cancer, and thank you so much for doing that, as well as my husband's. So for my listeners, what is a cavitation and how is it treated in biologic dentistry?
Well, a cavitation is really nothing more than a sluggish area in a bone. It doesn't have to be a jawbone. It usually is. Those are the most common areas, but other bones can become cavitated. Another, if you looked in the literature, it would usually be listed under osteonecrotic bone. Sometimes people take a blow to the hip
Mm-hmm.
or maybe to their patella, their kneecap, or other bones, and sometimes those bones will lose their blood supply and become necrotic. And It happens often in dentistry because in dentistry, we are always doing things that are somewhat traumatic.
Mm-hmm.
Um, Number one, some people just chew so excessively hard they can actually damage the bone.
Mm-hmm.
We we remove lots of teeth in dentistry, especially wisdom teeth, and those are the primary sites that we see for cavitations. I think we, quite frankly, don't remove teeth properly, um, and we oftentimes use too much anesthetic with what are called vasoconstrictors, usually epinephrine in it, which causes the blood vessels to shrink. And so, because all surgeons want a nice dry field when they do surgery, and so we tend to use too much epinephrine. We remove the tooth, we don't get an adequate blood flow into the site where the tooth was removed. And sure enough, you develop an area that doesn't heal properly. It becomes osteonecrotic or dead bone. It may not be completely dead, it can just become osteoischemic, where it just doesn't have adequate blood supply. And then if you have a stagnant area in the body, that's just not a favorable site. Whenever you have a stagnant area anywhere in your body, it tends to either fill up with heavy metals, which is interesting. These stagnant areas oftentimes in the jawbone are filled with heavy metals.
Right.
They become a reservoir for them. They become a reservoir um, for bacteria that don't like oxygen. So anaerobic bacteria infiltrate these areas, and they have a heyday in there because it's anaerobic, it's warm, they can do what they do there, and they produce the toxins that we've already talked about.
Right.
So a cavitation is a stagnant area, usually in the jawbone, filled with the microorganisms that it has. It'll have viruses, it'll have lots of pathogenic bacteria, it'll have their toxins, and it'll also have heavy metals associated with it.
Mm-hmm.
And oftentimes the body does a very good job of trying to wall that off. We can see it even on a cone beam, which is like a CAT scan image, or even sometimes on a panoramic image. We can see that the body has tried to wall this off by laying a dense layer of bone
Mm-hmm.
around it, just as a protective mechanism. But
Mm-hmm.
when we open these up, we oftentimes it just looks like an oil slick when we open it up, because we develop these degenerative fatty cysts inside these, and they spill out of there. They're under pressure 2 to 4 times that of the normal marrow.
Right.
And so that's what we see when we open them up. It's the way it's treated. There's a very small incision is made over the area where the wisdom tooth was
Mm-hmm.
removed, if that's where it is. It's cleaned out or curetted out with
Mm-hmm.
little very small instruments. It's typically not even a very painful procedure.
Right.
And then in our case, we like to not only, of course, irrigate that out, and maybe we will always use things like ozone and other disinfectants to really clean this well. But we also like to reintroduce the patient's own stem cells and platelets back into the area so that it'll stimulate the bone to heal again.
I think that process is incredible. Having gone through it personally, it was an incredible process because, it's very mindful, it's very thought out. And I love the entire process of putting your own platelet rich plasma back into that area for healing, because you're essentially using your own stem cells to heal that area. And getting rid of those microorganisms is extremely important. So the entire process is getting rid of the microorganisms, the bacteria, the infection, as well as then healing it in a very, very healthy way so you can have health back restored into your oral cavity. So definitely something that I would recommend. Now, who should be looking to having this done, Dr. Nunnally? Should they just have imaging done and sent over to you? How can somebody get in touch with you and your team to see if they should get cavitation surgery done?
Oh, that's such a good question, because there are many different cone beams or CAT scans for the neck up available now. And quite frankly, all of the various softwares don't interchange. So
Right.
we we encourage people not to send us their cone beams if they go have a cone beam done, because we get inundated with them, and we would rather that they just send a panoramic image.
Right.
which is less radiation. If we need a cone beam, we can take it when they come see us. But we can read usually because we've done these for so long and so many, we can usually see the cavitated areas on a standard panoramic x-ray. That would be our first choice. And so most of our patients like yours come from long distances. So they'll just email those
Mm-hmm.
images to us, and our team knows how to process that. And we have 4 doctors in there, each of whom will read those daily and get word back to the patients as to whether we think they have cavitated areas or not.
Well, good. Well, I personally have referred so many of my patients to you, and they've all been truly impressed and so well taken care of. So thank you for taking such good care of my own patients.
Mhm.
How would a new patient contact you, Dr. Nunnally, or your team, and how can our listeners find a biologic dentist in their community if they are unable to travel to you?
That's great. I would advise the listeners to go to IAOMT.org. Fabulous organization. When I became a member of that, Shell, maybe 20 years ago, there were maybe 100 of us. Now there are over 1,500 worldwide.
Mm-hmm.
And not all do the surgery, cavitation surgery, but
Sure.
many have been at least exposed to the concepts and know how to remove mercury safely. IAOMT.org is the great place for your listeners to go. And if they insist on coming to the hill country of Texas, uh, they can get in touch with us. If you just Google my name, you'll find us. But healthysmilesforlife.com,
Mm-hmm.
healthysmilesforlife.com is our website. And we have many um, instructional videos on that site. And we, of course, we see so many patients from long distances that I think we have kind of figured out the ways in which to really make that transition easy in terms of them incorporated into the seeing this.
Well, that's awesome. And thank you so much for your time today. And you've been a big part of our family's life and journey. And, I'm really happy to have you here on the show today. You've given such great information. And for all the work that you do, Dr. Nunnally, for all those patients out there, thank you. And
Thank you. It was a joy.
yes, take care. Have a wonderful day. Thank you,
Thank
everybody, for joining. We'll catch you next time on our next podcast. Thank you so much for making time for today's podcast with Get Well with Dr. Shel. I know that this conversation and education can help you to create your best life possible on every level. So definitely tune in to hear the newest expert and learn the latest protocols to support your best health journey. You can learn more about me and my wellness center at drshel.com, drshel.com, and I hope that you will make time to come visit us in the Houston area to take a deep dive on self-care. My team and I are completely devoted to helping you live a better life from this moment forward. The best days of your life are ahead of you, I promise. This podcast is a powerful and simple way to carry the wisdom of thought leaders from around the world in your pocket and continue to develop your own healing journey every single day. So let the journey begin.